All right, guys, we're going to go ahead and do our last scenario. So our last scenario is Gloria. Gloria is 61 years old. She came in for pneumonia and she has shortness of breath, so she's having a hard time breathing. We're going to assist the patient by recording her respirations. We're going to help her use the incentive spirometer to expand her lungs. And then the patient starts coughing frequently, so we're going to collect a sputum sample for laboratory testing. If the patient continues to struggle, you're going to perform oral suctioning to help them clear their airway, okay? So for this one here, we're going to start. She has pneumonia. We don't want to catch pneumonia, okay? So we're going to make sure that we're doing proper hygiene and everything like that. We're going to use our hand sanitizer. We're going to get our gloves going. Hi, Miss Gloria. My name is Lindsay. I'm going to help you out today. How are we feeling? Right? I'm checking on her, making sure she's okay, see how we're doing today. And while I'm hand sanitizing and stuff like that, I can start counting her respirations. There's no reason to wait. We can go ahead and do it now, okay? So I'm counting her respirations. Good job. I'm going to show you how to use our incentive spirometer today. So we're just going to use this to help us expand our lungs. We're going to make sure that it's opening up those airways so that we can help clear some of this out, okay? If you have any problems or if you feel uncomfortable, you just go ahead and let me know. So again, I'm getting my incentive spirometer out. This is the same thing that we used last time. So remember, we want to try and get her to get the ball into the smiley face here. So we have frowny face, smiley face in the middle. Our goal is to kind of get her to do it in, get it to that point. And remember, this is breathing in. This is not breathing out, okay? Okay, go ahead and take a deep breath in. Keep it in the smiley face for me. Great job. Starts coughing. Oh, I see that you're coughing. The doctor asked if you started for us to go ahead and collect a sample, just kind of see how we're doing. So we're going to do a big deep breath in and we're going to cough hard into this cup, okay? So we don't want all of the air that's stuck in your throat. We want deep in your lungs, okay, Miss Gloria? And then she's going to do a big cough into it. Remember, I'm not trying to get sick. We would have our N95 on. And then I'm going to seal it off. What goes on this is the same thing as phlebotomy. First name, last name, date of birth, my initials, when it was collected, okay? We're going to go ahead and send this off to the laboratory. And then she's still coughing. She's having a really hard time. And then the doctor said that it was okay if we go ahead and clear that airway for her a little bit, help suck up some of the mucus and everything like that. So this right here is a suction machine. It's all set up. The only thing it's not plugged in right now because Miss Gloria is not gonna actually have sputum. So this right here is gonna go into her mouth. We're not shoving this up her nose and we're not trying to choke her with it. It's kind of like when you go to the dentist's office, they're just using it to collect the stuff that's collecting in the back of your mouth. So let's say that she's like having a really hard time clearing it, or she has a lot built up, she can't swallow it, or she's not spitting it out, or she's starting to kind of go unconscious, anything like that, like we're gonna help her out by clearing her airway for her. So we're gonna put it in her mouth. Please don't break the mannequin's teeth. We're gonna put it in her mouth. Clear, take it out. Okay? Don't be like leaving this in there for long extended periods of time. We're gonna go 20 seconds, no longer than 20 seconds with this guy in the mouth, okay? So again, okay, Miss Gloria, you're doing a great job. How are we feeling? We feeling okay? You feel like you can clear it out a little bit better? You know, like stuff like that. We're just kind of checking on her and making sure she's okay. This one's pretty quick, that one's pretty easy. That's all we have to do for this guy here, okay?